many of you have gone through the this pediatric BLS training. So I think it's a good, if many of you are trained in already this BLS certified, then we will have a, class the more interactive. Linda sister also, okay, no ma'am. Okay, those who have not gone for the pediatric BLS also, it's okay. We will learn the basic things, okay? And those who are switching on the video, it will be great if you sit and listen to the video, because everybody is able to see those who are sleeping and all, okay? Sorry to say, but everybody is able to see that you are sleeping and all. Don't get, even if you are sleeping also, don't fall in sleep, okay? Okay, so I think few of you are already trained in BLS and many of you are not trained, so it's okay, doesn't matter. Okay, we'll learn today's also. So main objectives of today's session is we try to understand, who are the victims who actually need a CPR. And once you will identify the victims, then, when you are giving a CPR, it should be, qualitative, and it should be very much effective. Otherwise, there is no point of giving CPR. If you only just to press the chest, anybody can do. But being a health worker, at least I think we need to do in a proper technique, okay? So that we can help the patients to survive and prevent from further damage. Okay, so before starting our main session, I just wanted to give some introductions about our today's sessions. Okay, so I think in pre-test also I have asked you regarding the what are the main reasons of cardiac arrest, especially in a pediatric age group. Okay, so when we are talking about pediatric cardiac arrest, here the main causes is the respiratory problem. Okay, when we are talking about the adult, in adult it's mostly because of cardiac problem. It's only because of the heart disease, because we are adult, and then aged people, there's so many complications is happening related to the hearts and all. But when we are talking about pediatric age group, it's mainly because of the respiratory causes. Okay, so that is the one thing. And sudden cardiac arrest is one of the main causes for death of the newborns, even for the adult also. Even in nowadays, even in adult also, you can see so many people are dying because of the cardiac arrest, that there's sudden death of even the young people are dying. So yes, because of sudden cardiac arrest, many people are dying. And how it's dying, usually what will happen if we are not able to give a proper quality CPR, the main organ of our body, like it's a human brain, it may not survive after 4 minutes. So that's why whenever we are talking about CPR, it's always an emergency procedure. Okay, I'll tell you in definitions also, but it's always an emergency procedures. We don't want to go delay our procedures, because we wanted to do as fast as possible so that we can prevent further complications. But unfortunately, what is happening? The emergency response team is coming little bit delay, or sometimes we are getting delay in activating the emergency response team. So usually it's taking more than 10 minutes or within a 10 minutes. And during those critical minutes, cardiac pulmonary resuscitations is provide oxygenated blood, especially to the patient's brain, and it will increase dramatically in the chance. If you do quickly, that means there is a high chances of patient survival, as I'm telling you. So that's why in these sessions, what we will do, we will try to learn how to do CPR effectively. Okay, so here before going to the main topics, I just wanted to show one research study. Here what they wanted to find is I just wanted to know how many of us are very much well aware of the CPR procedure. You can write in the message how many of you are confident enough to do CPR. You can write yes, no. Those who are confident enough to do the CPR, you can write in the message yes, no. I can see. Okay, Babita, you can do. Thank you. I want a participant to give the message, actively participate in the sessions. Okay, 29. Yes, no, ma'am. Okay, no problems. No, yes, yes. Okay, no, yes, no. Okay, so that means many of you are responding with the no. Okay, so that is true. Because see what is happening, many of us, this is not a common technique. No, we only do when there is a need. And sometimes we forget to do the revisions, or we forget to do keep on updating our knowledge. So there is many reasons. So that's why even this research study, they are showing the nursing student or the medical professional, they do have a poor knowledge as well as a skill related to the CPR. Even these research are saying. So that's why it's okay, even if we don't have that much knowledge, it's okay. But now if you know that you don't have a knowledge, then you have to learn how to do the CPR, so that at least you can save someone life. Okay, so that is the main reasons why we are here. So definitions, this is according to American Heart Associations. What they are suggesting is it's a rescue procedure. Okay, this pediatric basic life support, it's just a rescue procedures. And what is the main purpose of this procedure is we wanted to, prevent the, as I told you in an introduction also, we wanted to save the brain and we wanted to prevent for further damage. And if you do the CPR, what be happening? We are, as fast as possible, we are recovering the spontaneous circulations or breathings. That is our main motive for doing a CPR. If we'll do as fast as possible, then we can prevent for further brain damage. So this is the pediatric basic life definitions. So what is BLS? Can you write in the chat box those who have gone for the training, or even if you have not gone for the training also, I think you have some idea about the BLS. So what do you mean by BLS? You can write in the chat box. Okay, basic life support. Okay, so usually can you briefly explain, so what do you mean by this basic life support? Only even one or two line if you want to say, no problem. Basic life support, thank you. That is the full form of these things. BLS. Anyone wants to explain little bit? If you want to talk also, please raise your hand. Okay, it's okay. Even if it's mistake also, we are not expecting a correct. Okay, it's okay. We just want a participant to be little bit active. Basic life support, emergency rescue procedure. Thank you, Dinah. Basic life support. Okay. Okay. To improve the deterioration conditions of patients, airway, breathing, circulation. Thank you. Basic life support. Okay, to establish airway, breathing, and circulations. Thank you, Kalkama. Breach help support until help arrives. Basic life support, emergency saving life, golden minutes, in safety, CPR. Thank you so much. In definitions, you are giving us so much information to save the patient's life by giving a CPR. Thank you so much. That means at least you have some rough idea, like what do you mean by BLS? Okay. So here, basic life support, as you have mentioned in the chat box, like, maintenance of the airway, breathing, and circulation. Yes, you have correctly said. So whenever we are talking about basic life support here, mainly we are talking about this airway, breathing, and circulations. But what is the difference between the advanced life support and basic life support is only in basic life support, we will not use any drugs. We are not use the advanced technology. Okay, here only we will use the airway or some protective shield while doing the procedures. But when we are talking about the advanced life support, here you will use many kinds of drugs, you will do the intubations and all. So all this kind of stuff we'll deal in next class. Okay, so basic life support is wherever you are, you will at least able to revive the patient's life. Okay, without using any much more devices or the equipments. Okay, just even the simple airway devices, or if you'll use any protective device, it will help you to perform the procedures. So that is the main basic definitions. So when we are talking about BLS, I have seen in the chat box that many of you are writing ABC, and many of you are writing circulation, breathing, and these things. Circulation, breathing, and what is airway opening or something is there. So now there is a slight change in the steps. Can you write in the chat box what is the changes in the steps now? You called ABC, or any other name is there instead of ABC? Thank you, Lindo. CAP, recognition of SCA. Okay. CAP, Shanti. Okay, Zoom user, please rename your device. Nirmala, CAP. Okay, BCA, CAP. That means many of you are updated with the these things. updated with the procedures. Yes, now they have changed into from ABC, it has changed to CAB. Okay. So mainly in BLS, as I told you, airway breathing and chest compressions. Now we will discuss about the CPR. CPR, as everybody knows, is a cardiopulmonary resuscitations, and it's an emergency technique, as I'm telling you from the starting. Usually, what will happen, what you will do in this technique, when the person is stopped their heart, or when the person's breathing has been stopped, we use some techniques so that we wanted to revive, or we wanted to restore their breathing and then heart functions as fast as possible. So that is the main definitions of cardiopulmonary resuscitations. Purpose, as everybody, you already in a definition of you, many of you have mentioned that blood circulation, clear airway, or artificial ventilation, these three are the main things that we will discuss in the entire sessions. Okay. And even I have seen in the chat box that this is the basic support that we will give, either till the advanced life support teams will arrive, or any persons who are very much trained in performing for the procedures. Once till the people will come, you can continue. We are just doing a basic techniques, okay, so that we can buying some amount of patient's time. So that is there. So what are the indications of CPR? As per your understandings, what are the different indications for CPR? You can write down in a chat box. I have 1,000 participants, so I want minimum 200-300 fatavat. Okay. What are the indications of CPR? Okay, respiratory arrest, cardiac arrest. Thank you, Nitya. Gasping, no pulse. A breathing problem, cardiac arrest. Okay, respiratory arrest, cardiac arrest. Okay. Respiratory, cardiac, airway obstructions, no pulse, low heart rate, cardiac arrest, apnea. Okay, thank you so much. I'm getting a lot more response. Thank you so much for actively participating. Indications sudden cardiac arrest. Many of you have mentioned in the chat box, no, cardiac arrest. So thank you, it's correct. And if the patient is unconscious, but when the patient is unconscious, you have to check carefully, okay? Only if the patient is unconscious and you start performing CPR, then what will happen? If it's a child, then they will slap you. So you have to be very much careful, okay? No respirations or brief irregular, or if the patient is gasping, you have mentioned, and no pulse. So these are the four main indications for CPR. Now talking about the contraindications. What are the different contraindications? In which cases you will not do CPR? If anyone wants to speak also, I'll give you access to talk, okay? So you can write here, what are the contraindications for CPR? In which scenario you will not perform CPR? Fracture of neck, rib fractures, okay? Spinal injury, chest trauma, rib fractures, okay, chest trauma, fracture of rib, chest trauma, unconscious, okay, fractures, respiratory hernia, suffocations, pregnant. Here we are talking about pediatric age group, spinal injury, fracture of ribs, lung injury, ribs. Okay, thank you. So here, do not resuscitations order. Usually, if the patients party or the guardians will tell you, do not do the resuscitations. In that cases, what we will do, we will not do the resuscitations. But here is a slight difference as compared to the adult. When we are talking about adult, that means adult have full right, and they can say ki, don't do the resuscitations if I went into that phase. But what about children? How you will sign, or how you will sign the DNR form? Any of you have experience of signing the DNR form, especially in a pediatric ward, NICU, PICU, wherever, with a child age group? Do you, any one of you have any experience? How you will take the DNR form? My first question is how you will take the DNR form, from whom you will take, and what you will do during that case. Any one of you, if you want to talk also, I will give access to talk. Anyone wants to share any experience? Anyone wants to talk, you please raise your hand. I'll give you access. So I just wanted to, okay, from the parents, you will take, Nitya is saying, okay, from doctors, from fathers, mothers, okay, parents or the legal guardians, thank you. Okay, from parents or attendants. Okay, from the guardians, parents and legal guardian. I will ask you one more questions. What you will do when some parents are, what they will do? They will say, ki, though while performing this CPR, there is a high chances of, negative or a negative effect of CPR. Either you may kill the patients while doing the CPR, and medically, like doctors will not perform. But so in some cases, patient party or the parents will ask you to do the CPR. So any of you have ever come across this kind of situations where doctor is saying if we will do the CPR, the baby may die. But some parents will ask, no matter what, you just do the CPR and help the baby to revive. So what you will do in that case? No, none of you have experience. None of you have come across such experience where there is a conflict of, idea between the doctors and then staff. From one who is responsible. Okay, no, ma'am, take consent. So, Nitya, can you explain what kind of consent? You want to speak, Nitya? I'll give access, like how you are taking a consent. When there is a lower chance of survival with CPR, we discuss with the parents and doctors. Okay, I agree, but the doctor is saying if I'll do the CPR, your baby, there is a more, harmful effect of doing CPR. But in some cases, parent will say, no, do it. Whatever will be the consequences, you just do it. In that scenario, what you will do or what doctors will do? Have you come across these situations? Okay, high risk consent you will take. High risk consent, maybe consent. Okay. So, Bhuneshwar, can you give the documents in the chat box which I've shared with you? What will happen? I'll give you one document which has been completely written only about the do not resuscitations. Okay. So usually what will happen if the parents will sign a DNR, then definitely we are not going to do CPR for the baby. That point is clear. And especially if the child is there or children above the 18 years of the age, if the baby is, if the child is not mentally fit to do sign or fit to sign the consent above 18 years, in that cases also we get signature from their parents. But in some cases there is a conflict between the doctors and the parents. For example, doctor will say medically your baby will not fit for CPR because if I'll do the CPR, baby may die instead of surviving. Okay, so in that case, if the parents will ask you to do CPR, then in that case, being a doctor or a health professional, we can do two things. First things, you will tell them to take a second opinion. Okay, and second thing is like if they are not willing, then they can go to other hospital and request the same things. But even though when they are taking a second opinion also, you have to be very much careful. Okay, we will discuss with our teams in hospital teams, and then if it conclude that we will reevaluate whether the patient is eligible for doing CPR or not. If they will say that it's not eligible, that being a health professional, we will not do the CPR because it will again cause some kind of harmful effect in our license. So then we will not do. Okay, we will clearly tell. And then even if they wanted to convince more, we can go to and talk with our legal teams and all that. So that is a long procedure. So I have given these things. Bhuneshwar will share the documents in the chat box, or I'll give you in the WhatsApp also. You can go through it. Okay, I think you understood what you can do in that case. If any of you have any doubt, you can again write in the chat box. I can explain you once again. Okay. If you got understood, then I'll proceed further. So in case of do not resuscitations, we will not do. And if the doctors will feel like it's not justifiable or if it's medically futile, then we will also not do, as I already told you. Cardiac arrest, as everybody knows, it's a sudden stoppage. And here what will happen? Blood circulation stop flowing, and even our heart will, if heart is not performing or not pumping, then definitely blood will not flow throughout our system. There is no point of, circulation. So that's why it's also called a circulatory arrest. And it's a medical emergency. Preparations for the emergency, we will do the 4 preparations. First, we will talk about the personal preparations. Second, staff preparations. We will keep some backup medical assistance. And last one is office preparations. When we are talking about office preparations here, mainly we are talking about 2 things. One is related to equipment, emergency equipments, like intubation tray, emergency drugs and all. So all the things have to be ready. It's not like that you are about to do CPR and you are searching here and there for the drugs. It should not be like that. Okay. So ABC, when we are talking about the component of BLS, there are 4 components. Okay. We'll first ensure safety. Second, you will recognize whether patient is actually in a cardiac arrest or not. And once you will sure that patient is in cardiac arrest, then we will activate our emergency response teams and we will continue with our BLS procedures. Okay, this before it was like ABC. In 2010 it has changed to CAB, as many of you have mentioned in the chat box also. Like it's now it's a CAP sequence: compressions, airway, and then only breathing. We just wanted to compress the heart so that at least some amount of blood will go into the brain. Okay, so in that way, at least we are sending some amount of blood in the brain as fast as possible in order to avoid the brain damage. Then you can check for the airway and breathing. Now, talking about the ensuring safety. So whose safety they are talking about? You can message. Whose safety they are talking about? You can write in the chat box. Sorry, I will be asking much more questions because it's like, if only I'll talk, then it will be boring. Okay, if anybody wants to talk, please raise your hand. We are talking about patient safety. Okay, patient safety. Vinita, our safety. Thank you. Patient safety, patient safety, patient safety. Patients and our safety. Patients, our safety. Our safety, rescuer and victim, both patients. And thank you so much. Those who are talking about only our safety, you are so much dedicated. You forgot taking care of yourself. And I think we have to take care of ourselves also, as well as patients. Okay. Otherwise, if it's not in the hospital, okay. If it's in the hospital, then there is no need to worry about your safety because you are already in a safe place. Okay. But when we are talking about some kind of road accidents, or if there is any kind of building collapse or any kind of incident that has happened outside the hospital, that means you have to take care of yourself also. Otherwise, while performing CPR, you will be pachacked. Okay, so that's why you have to take care of yourself also. And obviously, patient safety is our topmost priority. So, okay, so safety of self and safety of the client. Many of you have mentioned safety of both. And whenever you are talking about movement of trauma, when we are talking about safety of the patient, especially you have to take care if you suspect that patient is having some kind of spinal injury, if the patient is kind of road accident and all, if you are helping them and if you are not thinking that the patients might have a spinal injury and you are mishandling the patient, in that cases you are on that moment you will survive the patients, but what will happen later is you are giving a lifelong problem to the patient. So that's why if you suspect the patient might have some kind of spinal injury and all, you have to take extra care for the patients, okay? Because we don't want to give any kind of further injury. So that's why, especially during trauma and all, whenever you are moving a patients, be careful, okay? Be mindful. Make sure the environment is safe for both of you. So now first step is ensuring safety. Now I think everybody understood now how we have ensured our safety. Second is like we have to recognize the cardiac arrest. How you will recognize the cardiac arrest? Oh, let's talk about adult. In adult, what you will do? And what you will do in pediatric age group? How you will identify cardiac arrest, especially in the pediatric age group? Write in the chat box. Am I audible? I'm not getting a single response. How you will check okay, no pulse, heart rate and oxygen decrease, pulse less than 60, check pulse and breathing, check response cap, no pulse, no pulsation, carotid pulse not present, chest pain, okay, bradycardia, no pulse, no breathing, check pulse, SpO2, cyanosis, respirations, okay, drop saturations, carotid, okay, keep responding. I have 1,000 participants, so at least 100 to within a minute, I should get 100. Decrease heart rate and pulse rate. Okay, unresponsive, no heart rate, no pulse. When patient is not responding, okay, check for consciousness. Thank you. I'm getting almost all the answer here in chat box only. Okay, decrease heart rate and pulse rate. Okay, thank you so much. So when recognitions of the cardiac arrest in children, you will do the tapping like what we will do in adult. Usually we will tap the soldiers. No, are you all right? Are you all right? You will tap in adult. So the child who is able to understand your response, in that cases you can use a technique like a tapping technique like an adult. But when we are talking about infant, we will not do like that. Okay, because they will not able to say you that okay, I'm okay or something like that. They will not able to respond, infant and all. Okay, so in that case, what you will do, you will tap the soul and check for the response. If you see any kind of responses, then you can do the further procedures, but do not tap on the soldiers. If the child or the infant is unresponsive, then call for the help by shouting and proceed to check pulse and breathing. Usually before going, I am here in the procedures, so even in technique also, I will talk about child, infant. Okay, so what is the difference? Which age group you will consider as a child? Which age group you will consider as a child? You can write in the chat box. Infant, I think everybody know, below less than 1 year. Above 5 years, okay. No. Above 5 years, 5 to 12, okay. 1 to 12, below 1 years. Infant is below 1 years, below 1 year. I'm asking about child, above 1 to 5 years, above 5 years. In which age group you will call as a child? 1 to 8 years, Akshay, thank you. Below 12, under 5. What about 6, 7, 8? Below 12. Above 4, less than 13, 5 to 9, 1 to 5. Oh, okay, thank you so much. Usually this when we are talking about child age group, no, it's in some of the book they have mentioned 1 to 12 years. In some of the book they have mentioned about 1 to 8. But especially being a health provider, we will consider like 1 to till the puberty. Okay, puberty may be 12, 13. So from 1 year till puberty, we will consider as a child. Okay, so that is there. Then we will proceed for the further. So can you message in the chat box what is the next step? I ensure the safety of both. Second, I recognize of the cardiac arrest. What was the next steps I have mentioned before we were starting in few slide back only I have mentioned. What is the next step now? I recognize cardiac arrest. Now what I will do? Compressions, okay. I'll do compressions, check pulse, check cap, call for help, check pulse. Okay. So now I will activate the emergency response team. How many of you are member of this? First, I just wanted to ask, in your hospital, do you have emergency response team or do you have code blue in your hospital? You can write yes or no. Bimla Tamang, no. Okay. Baleri Nitya, no. In how many hospital do you have a code blue? Lisa, no. No. Code blue. Fanai, can you rename your device? Opportunity, yes. No, yes. Similar risk. One risk, no, yes. Anyone wants to share? Anyone? Okay, Risuklang, yes. That means I think majority of the answer I'm saying a no. That means many of the hospital doesn't have a code blue. And few hospital you have a responding as a yes. Those people who are responding a yes, do you want to speak? Do you want to share like how code blue is functioning in your hospital? Thaba, you want to speak? Lanangai. Sorry, if I'm mispronounce your name. No. Thaba, do you want to speak? Anyone wants to share the experience of the code blue? You can raise also. I can give you access to unmute. If your code blue is there in your hospital, do you want to share your experience, how it's functioning actually? I request the participant to switch on your video, please. If your network is good, switch on your video. Premila, you want to speak? You want to speak? Okay. Bhuneshwar, can you give access to this thing, Premila? Bhuneshwar?
Yes, yes.
Okay. You can unmute Premila. Premila, I think you can unmute now. Yes.
Okay. Hello. Can you hear me, ma'am?
Yes. We can hear you.
Yes, actually, I didn't hear the question properly, but as soon as I saw that code blue, I just remembered the cardiac OT. So I'm just trying to remember it. A long time I left OT, but still then code blue, like once the patient is having cardiac arrest, then there is a team called like code blue means who are in the cardiac team. Doctor, then and along with the staff. So the one who is activating code blue first will check the patients. After that, they will activate the aid code blue. There is a switch there. We will shout for help. Then we'll activate that code blue. Then at that time, all the team members, including the anesthetist, including the surgeon, and including all the staff members of this code blue, will come and attend the patient. And we'll start this basic life support. Whoever is there will start the basic life support at that time. And as soon as the code blue team reach, all the advanced life support will be done with them.
Okay, thank you so much, Premila sister, for sharing your experience.
Yeah, but long time I forget to. I just remember that code blue, so little bit I'm explaining.
No, it's okay. At least people are able to get a brief idea, because only if I'm speaking, no, sometimes like voice will be boring. So that's why. And thank you. I appreciate that you willing to talk in front of others. Okay, any other wants to share your experience? Any others? If any of you are a member of a code blue, can you speak or can you share your experience, like how you are performing? Okay, Rilan has mentioned like if you are announcing a code blue, you have to announce for it 3 times from your locations. I request others to please mute yourself. Okay. Okay, anyone wants to share, you can raise. I'll give a chance to speak. When the code blue is activated, all the team will reach at once. Okay, thank you. Yes. Okay, I think at least we got a few response. Okay, wait a minute. Okay. Yes. So when here emergency response team, actually in code blue, each hospital should have a code blue. And in code blue, as sister correctly said, no, we have a team member, 5 to 6 members, 6 to 7 members. We used to have a team member, and each members are assigned to their role and responsibility. Okay, so when they will announce the code blue, and yes, one of our participants have mentioned, when you are announcing the code blue, you have to announce it 3 times, but plus you make sure that you will tell about the locations. It's not like I'm in a 4th floor. So 4th floor where? You have to mention about the room, bed numbers, and then floor. You have to give the clear information so the other team member will reach that locations correctly and on time. Okay, so there should not be any confusions. And yes, so that is there. So activate a code blue team or any emergency response team, and at the same time you start collecting the device AED before starting a CPR. Otherwise, send someone. If you are alone, you can, take a help from anyone, because we wanted to start the procedure as soon as possible. Okay, so we will start our basic life support steps. Now, once the rescue team will come, okay, once you have ensure that you are also safe, patient is also safe, we will check for the responses. As I have seen in the chat box also, many of you have mentioned. When you are checking for the response, I'll show you the demonstration also, okay? When you are checking for the response, if there is no response, then shout for help if you are the only one, okay? And if the patient is responsive, okay, patient is conscious, responsive, if patient is breathing and you are able to get the heart rate also, then keep the patient in a comfortable positions. What we are talking about comfortable position is in recovery positions, okay? Check for the breathing also. When we are talking about check for the breathing, you have to check for the pulse both simultaneously, because within a 10 second, you have to check breathing and this pulse rate circulation at the same time. Okay, and when you are checking about the pulse, in case of infant, you can use these things. You can use a brachial artery. Okay, I'll show you in the demonstrations. And in case of the children, you can use a carotid artery. So check the pulse, but should not check. It should be checked within a 10 second. Okay. If when you are checking the breathing and then pulse, if the breathing is present, as I told you, if the pulse rate is also there, you can keep the patient in a recovery positions. Here I have mentioned the recovery positions. In this way, why we are keeping the left head tilted? We just wanted to keep the airway open, and here hand support the head and mouth toward one side. We will support to the ground, okay, and then knee you have to flex little bit, so that what will happen, the baby will not roll over, okay. So that's why we are keeping these positions. But again, I'm coming to this area, okay. I think you are able to see my cursor. If you found there is no breathing or the patient is gasping, okay, then you can check for the pulse, as I told you. And when you are checking pulse, the pulse is palpable. If it's more than 60 beats per minute, but there is no normal breathing. You found the pulse rate, but there is no breathing. Then you can only give the rescue breathing. Usually what I used to do, even when even I had experience when I was working in Bihar, that time initially what will happen, we get confused. When the cardiac arrest means, we directly start giving rescue breath and start doing a CPR. But if the patient is having a pulse rate 60, more than 60, then no need to do the CPR. You can only give the rescue breath. Okay. And rescue breath, one breath you can give every 3 to 5 seconds. Our main target is like you should maintain 12 to 20 beats per minute. And then at the same time, you can activate emergency response team. If you have not activate, okay, after 2 minutes, and continue rescue breath. And once you continue rescue breath at least for 2 minutes, then after 2 minutes, again check for the pulse. Okay. And in this area, if when you are checking a pulse, there is no pulse, there is a bradycardia, patient is having a poor perfusion, then you can move towards the compressions. When I am talking about poor perfusions, how you will identify the poor perfusions? What are the symptoms for poor perfusions? Write down in the chat box. What is the sign for poor perfusions? Sorry, I'm asking too much, but I just wanted to make it interactive. SpO2 decrease, low volume, okay, cyanosis and all. Okay, so usually in poor perfusions, cyanosis and all you will see, and even the patients will have a nausea and vomiting sometime. Okay. And we'll start with the chest compressions. So when we are doing a chest compressions, I think I have asked in the pre-test also. When you are compressing the chest, it should be 1.5 inch for infant and 2 inch for the children. But try to maintain the rate at the rate of 100 to 120 beats minutes. Okay. And when you are doing the chest compressions, please allow a complete recoil of the chest. I'll share you the video in the WhatsApp group, like how you can give effective chest compression and what will happen if you will not do effective chest compression. I'll share you the video. Okay. Then when we are doing a chest compressions, we need to identify the Ziphisternum. I think everybody know what does Ziphisternum means. We'll place one finger. Okay. Once you will identify the Ziphisternum. Once you will identify the xiphisternum, then you place the one finger there. Okay, once you'll place the one finger on top of the same finger, you can put another two finger. I think I have shown you in the pictures also. You can see. Once you place the two fingers on top of it, you can remove that first finger, which you have used for locating xiphisternum. This finger first, initially we have used for locating the xiphisternum. Now you can remove this one, and only with the two fingers, you can give a chest compression. I'll demonstrate you, okay? If you have any confusion, I'll do the demonstrations. And compressions must be delivered on the lower third of the sternum. Okay, especially it should be below the nipple line. This is a nipple line which I gave the forefinger. Just below the nipple line, you can place your two finger and then start doing the chest compression. If it's a small baby, then you can use you can use a thumb technique. Okay, using the same landmark, but especially this thumb technique we will use if you have a two rescuer. Okay, but because if you are alone there for a chest compression, then what you will do, doing a chest compression with the thumb and then again giving a rescue breath it in this way, you will waste the time. Okay, if it will be more effective if the two people are there to do the CPR. And in a child, same, identify the xiphisternum. Then you can place your one palm. Okay, it depends upon the baby, child age. If the child is big and quite obese, you can use both hands, or if child is small and all, you can use the one hand. So it depends. Okay, so when we are doing a compressions, we give a 30 compressions for one if there is only one people. But if there is two people are doing CPR, then we can use as a 15:2 ratio. Okay, you can write down queries. Okay, later on, whatever queries you have, I'll show you the demonstration and flow chart also. So once we will done with the chest compressions, okay, then you can do the open airway. Okay, you have in pre-test, I have asked you we will continue the rescue rate at least for the 5 cycle. Okay, 5 cycle is equals to 2 minutes. When you are doing a 5 cycle, like 30 compression to rescue breath, if you'll do a 5 cycle, then it's almost 2 minutes. Okay, and after that also, if you have not activated your emergency team, try to activate as fast as possible. More people, more effectively you will be able to do it. Okay, I think now we done with the chest compressions. Second, we will do with the open airway now. How we will do the open airway? There is a two technique. One is head tilt or chin lift positions. I think most of you are known about this one. And second is a jaw thrust technique. Okay, so this is here I have shown the some of the picture. I think this is incorrect. This is a hyper extensions. Okay, this is the hyper extensions. This is incorrect. It's too much. Okay, this is a correct. We wanted to make the airway this thing in a same alignment. Okay, we don't want too much extension and we don't want too much flex. We want to keep the baby airway in a straight line so that easily air will enter inside the baby lungs. Okay, so this one is a head tilt. I'll demonstrate you how to do head tilt and chin lift positions. Okay, this one is a jaw thrust techniques. This is jaw thrust technique for the child and this is for the infant. Especially when we will do the jaw thrust technique. When we will do, you can write in the chat box when we will do. When we will do the jaw thrust technique. Spinal injury, cervical injury. Thank you so much. Okay, so when you suspect any kind of spinal injury, cervical injury and all, we will do the jaw thrust because we don't want to move the baby. We don't want to do unnecessary movement of this cervical spine. Okay, that is there. Then we have opened now after the chest compressions, open airway. I think you got the idea how to open a baby's airway. Now we will give the breath. Okay, when we are giving a rescue breath, there is a different technique. Okay, one technique, either you can give mouth to mouth. Okay, second technique, whether either you can give mouth with baby mouth and nose. You can cover both mouth and nose, or either you can use any marks, like especially emboback marks and all. You can use any marks. Okay, or you can use these things bimanual ventilations you can use. So in these 4 technique, you can give a rescue breathing. Okay, I'll show you the demonstration. So this is a mouth to mouth. This is mouth to mouth and nose. Okay, and this is mouth with this barrier devices. We will continue. We will continue till the sign of life. You will see, or if any qualified trainers or if any people have come, then you can continue till there. And if till the advanced life teams will come, you can continue till there. Or if the patient is okay, all right, then you can stop. This is emergency situations. Don't get panics. You have to be thorough with all the steps and all. Okay. And then you will give. This is a flow chart. Okay, this is a 2015. Actually, I have kept the 2021 also. Every 5 years, guideline will change. I think everybody knows that. Okay, so that's why you have to keep on updating. This is a 2020, but I didn't got the clear pictures of this one. That's why I keep the 15 also. There is not much difference between the 15 and 20. What is there? Only difference is here. In 15, they are telling to give the rescue breath 3 to 5 seconds, and you can continue up to 12 to 20. But now we are saying 2 to 3 seconds you can give, and 20 to 30 breaths per minute. Only differences is here. Rest is almost same, which I have already told you. Okay, this is for a single rescuer, by the way, and this is for the, if there is two people are there, two provider or more than that, two is there, then we will use this technique. Scene safety, we are checking the responsiveness, shout for help, activate emergency team, and look the breathing and the breathing and circulation same time. That means within a 10 seconds, you have to complete. If the baby is breathing normally, you can keep in a recovery position. If not, if breathing is not there, but you found the pulse, give only the rescue breathing. Check pulse after 2 minutes or after 5 seconds. Then check for the heart rate. If the heart rate is less than 60 or plus poor perfusion, then go for CPR. But if you found the heart rate more than 60 and patient is breathing, then it's okay. Okay. When you are starting CPR, if 2 rescue breathing, that means 30 is to 2. If if only one person is performing, then 30 is to 2. If 2 people are there, 15 is to 2. Okay. And try to collect AED as soon as possible. And this will give the shock, AED. This one we will discuss detail in ACLS class. Okay. So these are the steps. So I'll show you the demonstrations. I hope everybody understood. Now doing the demonstrations, I will ask the same questions which I've asked here. Okay, because the same step only I'm going to show the demonstrations. Okay. Camera you can put there only, I think. If you zoom. Give us few minutes. I think my screen is visible.
Yes.
Okay, thank you. So now whole steps again, I'll do once again. Okay. So first we have to ensure the safety. Now it's in hospital only. Okay. So when you are ensuring safety, as I have already mentioned, we talked about our safety and then baby safety. Here the baby is safe. Okay. Everything is, baby is in safe. Once you are ensuring the safety, you will check for the responses. Okay. So this is a newborn baby. So we will not tap on the soldier. Okay. We will just, how we will do the check the responsiveness, we will do the flickering in their feet. Okay, 1 to 2. Here also 1 to 2. You will just tap on the sole of the baby, not in the soldiers. Okay, but if it's a child, we will tap on the soldiers. So now baby is if the baby is responsive, then it's fine. But if the baby is not responsive, then we will check for the breathing. Okay, when you are checking for the breathing, you have to check breathing plus pulse simultaneously, and do not waste much time. We will check within 10 seconds. Okay, and in that case, you can use you can do like this. Okay, so at the same time we will hear the sound, and then at the same time you can see the this thing's diaphragm, whether it's moving or not, and at the same time you can check the pulse. And in baby, where you will check the pulse? In infant, where you will check the pulse? It's okay, no need my face. This thing in infant, where you will check the pulse? See the message, take the new message. In infant, okay, brachial artery. Thank you so much. If it's a infant, then we will check in the brachial artery. Okay, here. So I'll just show you this. In brachial artery, you can check the pulse if it's a infant. But if it's a children, where you will check? If it's a children, where you will check? Carotid. Thank you so much. Okay, if it's a children, then we will check in the carotid. I think it's in carotid. I think everybody knows. Okay. So you have to do the simultaneously, that both the things you have to do simultaneously. If you found the breathing also, pulse is also there, then you can place the baby in a recovery position because everything is fine. So when you are keeping the recovery positions, you have to keep in a lateral positions. This hand, actually it should be just below the chin, and then you can fold this like that. Okay, why we are doing in a lateral position? So that baby will not aspirate. We'll keep this one just below the head, so that it will not baby will not roll. Okay, we are placing like this, so that what will happen, baby will not roll like this. At least you do it, this knee will give some support. So this is a recovery position we will keep if baby is breathing normally, and then pulse rate is more than 60 or equals to 60, more than 60. Okay, but if there is no breathing, or if there is if there is no breathing, but you got a pulse, then I will give you only rescue breathing. Okay, so I think everybody know how to open the airway. When open the airway, I told you head lift and head tilt and chin lift. Head tilt means I'll place one hand on top of baby forehead, and then chin lift I'll just put in here, and then I'll try to lift it. Okay, this is a head tilt and chin lift position. This is the one way where you can open airway. Others, okay, in jaw thrust technique, I think in jaw thrust techniques, what we'll do, we will keep the fingers here, and then in the cheek, bony area, we will keep. We don't want to move this neck. Okay, we will just wanted to these things. Now lift the chin. This is a jaw thrust technique. We don't want to move the neck. We only want to lift baby chin. Okay, if you are doing a too much way, if you are not lifting correctly, what is happening? If you are not lifting correctly, that means it will happen like this. Okay, so it should not be like this. We are not we are not pinching their mouth. Okay, we wanted to lift. So that means that's why you have to give a little bit pressure on the bony area of the baby chin, and then from here you have to lift like that, so that baby mouth will be not like that. Okay, so this one is jaw thrust technique. So I have opened the airway. Okay, open the airway. Now while giving a rescue breath, I can use a 4 technique. What are the different 4 techniques for rescue breath? You can write in the chat box. I can see the message. In how you will give mouth to mouth. Thank you. Mouth to mouth means with my mouth, I'll only cover the baby mouth. Okay, I will only cover the baby mouth. That's one is mouth to mouth. Mouth to nose and mouth means I'll cover baby nose and then mouth. Both I will cover while doing. Okay. Next is so next is these things. Next you can use any barrier devices like marks and all you can use, and on top of that you can give it. Okay, so there are different techniques. You can use it for giving a rescue breathing, but this I'm telling you, actually this steps is after the chest compression only, but while maintaining a airway position only, I'm just telling you. Okay, so what will happen if the baby is these things? Then I'll give the rescue breathing. Okay, I'll give a rescue breath 2 to 3 seconds. in a rate. Okay, so we wanted to, within a 1 minute, we wanted to make at least 20 to 30 breaths per minute. We wanted to maintain that rhythms. Okay, so that's why you can give 2 to 3 seconds every these things. Every 2 to 3 seconds, you can give a rescue breath. After giving a rescue breath, means after a 5 cycle or after a 2 minutes, again check for the pulse. Okay, again check for the pulse. And if you found, if you found there is no pulse, okay, and if still you found a sign of poor perfusions like cyanosis and all, if you got, then we will go for a chest compressions. I think till now I'm not confused. I hope I'm not making you confused. Okay, so now babies having a poor perfusions and then pulse rate I got less than 60. Okay, that means I'll go for the chest compressions. When I'm doing a chest compressions, you need to locate the Ziffy sternum. Okay, you need to locate a Ziffy sternum. So this is a Ziffy sternum. Actually, this one is I'm taking a newborn. Okay, so that's why. So once you will locate a Ziffy sternum, then you will place a 2 finger on top of Ziffy sternum. Okay, so like this. You can place a 2 finger on top of Ziffy sternum. Actually, this finger should be just below the nipple line. This is a newborn, so that's why it's coming under the these things. Coming in between the nipples. But if I'm taking a child, okay, for example, if I'm taking a child, I think you will able to see or not. Okay, I am keeping this baby like this. Okay, for example, if this is a child, okay, this is a Ziffy sternum. Okay, this is a Ziffy sternum. I'm placing a 2 finger on top of the Ziffy sternum. Then I will do the chest compression. This is not a CPR baby, so chest compression is not there. Okay, so I can, that means see my finger, see my 2 finger is just below the nipple line. Okay, just below the nipple line. 2 finger is like that, and you can do with the chest compressions. If there is a 2 people, how much compression you will give? If there is a 2 people, you can write in the chat box. If there is a 2 people, how much compression you will give? 50:2. Thank you, Vinita. Thank you, Sujata. 15:2. Okay, but if there is only 1 people, how much you will give? If there is only 1 people, yes, 30:2. Okay, so for example, if you will give the compressions, you will give the compression in that way. Okay. You will give the compressions in that way. You will continue for the 5 cycle. Okay, you continue for the 5 cycle. And when you are compressing the chest, for the infant, we will use a 1.5 inch depth. Okay, you have to, when you are pressing, it should be for a infant 1.5 inch depth. And for the child, you can do a 5 inch. Okay, so you can do and you can continue at least for 5 cycles. Okay, at least for 2 minutes. And if it's a small baby, I think I'll try to. Okay. Okay. I'll try to sew like this. Okay. If it's a small baby, okay, in a small baby, we will use a thumb circling technique. I think I've shown you the pictures also. We'll place the, we'll do the measurement like before only, and we will place the thumbs. But here what we will do, we will place the thumb on top of one another. Okay, so that you more pressures you will not give while doing a chest compressions. This can also do. Okay, you can do like this also. And then if there is this technique, especially you will do when the 2 people are there. Okay, but otherwise, again, what will happen if I leave and I'll go there and again I started giving rescue breathing? In that way, I'll waste time. Okay, so if there is a 2 people is there, then you can use this technique. If only 1 people is there, better you will use this 2 finger technique. Okay, this is for the infant. And if it's a child, then what you will do? If it's a child, then again, as like before only, we will locate the area, and either as I shown you in the pictures also, you can keep the heel of your hand, and then you can start the compressions. Okay, when doing the compression, I think you know your hand should be straight and all, and you start, your whole body parts should be up. And if the baby is obese and big, child is obese and big, then you can use a two hand. Otherwise, we can use a 1 hand. Most importantly, try to remember we wanted to press 2 inch for a child, and for if you are dealing with the infant, We don't want to press much, only 1.5 inch depth is enough. Okay. So that is their chest compressions done. After chest compressions, a rescue breath, as I've already, these things, open airway and the rescue breath, as I've already mentioned you. Do you have any doubt? I think I've covered all the steps. Okay. I think understood. Or if you want me to show something, then I'll show you. Now you can ask the questions because from my side, I have completed. I'm exact on time. You have any queries, you can ask. It's clear, very clear. Thank you, thank you. Thank you. Those who have asked. Thank you for a unit. Do we start a compression only if heart rate below 60? Yes, chest compression. No, we will start only if the heart rate is 60 or less than 60. We will not do the chest compression if you found the heart rate more than 60. Okay. Demonstration is clear. Okay. Any questions you have? Anyone wants to share your experience? Those who have, done the CPR, and if baby has been survived, or if you have faced any challenges which you want to share with us, or any good practices that you have done in your hospital. We have 1,000 nurses, so we can learn from each other. Thank you. Any questions? When performing to rescue, how often should we switch? Usually after 5 cycles. So whenever you are switching, even for the adult also, what we say, you need to switch every 5 cycle. Okay, 5 cycle you will complete. The once 5 cycle means 30. If 2 people are there, 15 compressions, 2 rescue breath. Continue for 5 cycles. Then after that you switch. When you are switching also, you have to be very much careful. You do not switch from the same directions. Okay. If one person is standing here, change. Go to the another side and other persons will come this way. So that you will not get collide in between. Okay, while switching also, you have to be careful. Okay. While in infant, we have to check for brachial pulse instead of carotid. I think the infant neck is very short, no? See infant baby necks and see ours, a child's. Okay, I think because of that, in these things, newborn, it's easy to get in a brachial. And it's also very difficult to get in this one, no? In infant, it's very difficult to get in a carotid. See the baby, okay? Any other? For infant, it is tablet sequence, temperature, area, breathing, circulation, just theoretically came across. But for other, it's a gap. Okay, thank you. I think I have not gone through this one. Tommy, you want to share, you want to talk, you want to explain a little bit more so that also we will also learn from you. Tommy, if you want to speak, then I'll give you access to talk. DNR legal now in India. But DNR, we are, for adult, we are performing. For pediatric, you are doing? Yes, we are doing. Okay. Tommy, if you want to speak, you can raise your hand. Or anyone, if any, this is an interesting procedure. No, might be you have done a plenty. Anyone wants to share anything? No more. I think we'll stop then. Thank you. Thank you for those who have submitted the pre-test, post-test. Thank you. And then I hope everybody is attending. Munishwar, you can end the session. You can stop. Thank you